Autism, a neurodevelopmental disorder that affects how individuals communicate, interact, and behave, has become increasingly prevalent in recent decades. The rising awareness and diagnosis of autism have prompted many parents and caregivers to seek a deeper understanding of the condition, its causes, and effective ways to support children on the autism spectrum. Although it remains a complex condition with no single cause, a combination of genetic and environmental factors is believed to contribute to autism, along with changes in the brain. With greater awareness of the early signs, along with timely interventions and lifestyle adjustments, children with autism can lead fulfilling lives. This comprehensive guide delves into the underlying causes, recognition of early signs, and the ways caregivers can support children through holistic approaches and therapeutic interventions. The exact cause of autism remains elusive, but substantial evidence points to a combination of genetic and environmental factors. Studies consistently show that genetics play a significant role, as autism often runs in families. A child with a sibling or parent on the autism spectrum has an increased likelihood of also being diagnosed with the condition. However, the genetic aspect of autism is highly complex, involving multiple genes that may contribute to different traits and levels of severity. Some of these genes are inherited, while others arise as spontaneous mutations. Environmental factors also contribute to autism risk, particularly during critical stages of prenatal and early childhood development. Research has shown that exposure to certain environmental toxins, such as air pollution or pesticides, during pregnancy can increase the likelihood of a child developing autism. Maternal infections, complications during pregnancy, and even advanced parental age are additional factors that may elevate risk. These environmental influences, interacting with an individual's genetic predisposition, can set the stage for autism to develop. One emerging area of research focuses on mitochondrial dysfunction and its potential link to autism. Mitochondria, the energy-producing components of cells, play a critical role in brain function. When mitochondria do not operate efficiently, it can impair energy production, leading to neurological and developmental challenges. Some studies have suggested that mitochondrial issues may contribute to neurodevelopmental disorders, including autism. While the research in this area is still in its early stages, it adds another layer of complexity to understanding the condition. Advances in brain imaging have provided further insight into autism. Researchers have used techniques such as magnetic resonance imaging, MRI, to identify distinct patterns of brain structure and activity in individuals with autism. These studies have revealed differences in neural circuitry, particularly in regions of the brain responsible for communication, social processing, and sensory integration. By understanding how autism manifests at the neurological level, researchers hope to develop more targeted treatments and interventions that address the underlying brain differences associated with the condition. Early diagnosis of autism is crucial in providing children with the necessary support and interventions that can significantly improve their development and quality of life. For parents and caregivers, recognizing the early signs of autism is often the first step in seeking help. Children with autism typically exhibit challenges in social interactions, communication, and behavior. These challenges can present as early as infancy, but they become more noticeable as the child grows. Social interaction difficulties are one of the hallmark signs of autism. Children with autism may avoid eye contact, seem indifferent to others, or have difficulty understanding social cues. They may prefer playing alone rather than engaging with peers or struggle with imaginative play. These social challenges often extend to communication. Delays in speech and language development are common, and some children with autism may have difficulty starting or maintaining conversations. Others may develop speech but use it in unconventional ways, such as repeating phrases, echolalia, or focusing on highly specific topics. Restricted or repetitive behaviors are another key characteristic of autism. These can include repetitive movements, such as hand flapping or rocking, or an intense focus on specific interests or routines. Children with autism may become distressed when their routines are disrupted or when exposed to unfamiliar environments or stimuli. Sensory sensitivities are also common, with some children experiencing heightened reactions to sounds, textures, or lights. Developmental milestones, particularly in speech and motor skills, are important indicators for parents to monitor. If a child is not meeting expected milestones, such as speaking their first words by age 2 or engaging in interactive play by a certain age, it may raise concerns about autism. In such cases, it is important to seek a referral to a pediatrician or specialist who can conduct a comprehensive evaluation. Early intervention can make a significant difference in a child's development, as it allows for the implementation of therapeutic strategies that address communication, socialization, and behavior. Over the past few decades, the number of autism diagnoses has risen sharply, prompting widespread discussions about the potential causes of this increase. One of the primary reasons for the rise is greater awareness and improved screening practices. As autism becomes more widely recognized, parents, educators, and healthcare providers are more likely to identify the signs early, leading to more frequent diagnoses. Additionally, the diagnostic criteria for autism have broadened over the years, encompassing a wider range of symptoms and behaviors under the umbrella of autism spectrum disorder, ASD. While increased awareness accounts for a significant portion of the rise in diagnoses, research suggests that there is also a genuine increase in the number of children being born with autism. The reasons behind this increase are still being investigated, but some theories point to environmental factors, such as changes in maternal health, exposure to toxins, and shifts in lifestyle patterns. The complex interplay of genetics and the environment makes it challenging to pinpoint a single cause for the rise in autism rates. Nevertheless, the growing prevalence underscores the need for continued research, early intervention, and support for affected families. For children with autism, lifestyle adjustments can have a profound impact on their health, behavior, and overall well-being. One of the most important areas to focus on is nutrition. A balanced, whole foods-based diet can support brain health, reduce inflammation, and help regulate behavior. Children with autism may benefit from diets rich in fruits, vegetables, lean proteins, and healthy fats, particularly omega-3 fatty acids. Omega-3s, found in fatty fish like salmon and in flax seeds, are known for their anti-inflammatory properties and positive effects on brain function. Some parents also explore dietary interventions such as gluten-free or casein-free diets, although the effectiveness of these approaches varies from child to child. While there is no one-size-fits-all solution when it comes to diet, ensuring that a child's nutritional needs are met is essential for supporting their overall health and development. Physical activity is another key component of a healthy lifestyle for children with autism. Regular exercise can improve mood, reduce anxiety, and enhance social skills. Physical activities that promote coordination, such as swimming, dancing, or playing sports, can also help with motor development. For children who may struggle with organized sports, activities like walking, hiking, or cycling offer valuable opportunities for physical engagement and can be tailored to their interests and abilities. Exercise not only benefits physical health, but also has a positive impact on behavior. Studies have shown that regular physical activity can help regulate emotions, reduce instances of self-injurious behavior, and improve attention span in children with autism. Encouraging children to participate in daily exercise routines, whether through structured sports or free play, can be an important part of their overall wellness plan. Despite growing awareness of autism, several myths and misconceptions about the condition persist. One of the most damaging myths is the false belief that vaccines cause autism. This claim has been thoroughly debunked by numerous scientific studies, and there is no credible evidence linking vaccines to autism. Vaccines are a critical part of public health, and avoiding them puts children at risk for preventable diseases. Dispelling this myth is essential to ensure that parents feel confident in vaccinating their children without fear of contributing to autism. Another misconception is that autism is caused by poor parenting or a lack of socialization. This belief, which was more prevalent in the past, has been discredited by modern research. Autism is a neurodevelopmental disorder that is rooted in biology, not in external factors like parenting style. The challenges that children with autism face are the result of neurological differences in how they perceive and process the world, not due to the actions or inactions of their caregivers. It is also important to recognize that autism often co-occurs with other conditions, such as ADHD, anxiety, or sensory processing disorders. Understanding these co-occurring conditions can help parents and caregivers provide more comprehensive care for their child. For instance, a child with autism and ADHD may benefit from behavioral interventions that address both attention difficulties and social challenges. Similarly, children with sensory sensitivities may need strategies to help them cope with overstimulation in their environment. Access to comprehensive clinical care is critical for children with autism. Many clinics now offer multidisciplinary evaluations that involve a team of specialists, including neurologists, psychologists, speech therapists, and occupational therapists. These assessments provide a thorough understanding of the child's strengths and challenges, allowing for the development of personalized treatment plans. Behavioral therapy is one of the most widely used interventions for children with autism. Applied behavior analysis, ABA, is a structured approach that helps children develop communication skills, social behaviors, and daily living skills. ABA is often complemented by other therapies, such as speech therapy, which focuses on improving language and communication abilities, and occupational therapy, which helps children with sensory processing issues and fine motor skills. In some cases, medication may be prescribed to manage specific symptoms associated with autism, such as anxiety, hyperactivity, or irritability. However, medication is not a cure for autism and should be used as part of a broader therapeutic approach. Parents and caregivers should work closely with healthcare providers to determine the best treatment plan for their child. As research on autism continues to evolve, it is important for parents and caregivers to stay informed about new developments in treatment and intervention. Following the latest scientific findings and guidelines from trusted sources can help families access the most effective therapies and resources for their child. Connecting with other families affected by autism can also provide valuable emotional support and practical advice. Support groups, online communities, and local advocacy organizations offer opportunities to share experiences, learn from others, and find encouragement. These networks can be a lifeline for parents navigating the challenges of raising a child with autism, offering a sense of community and shared understanding. The rise in autism diagnoses has highlighted the importance of early intervention, comprehensive care, and community support. By understanding the complexity of autism and making thoughtful lifestyle changes, parents and caregivers can help children with autism thrive. With the right resources and support, children on the autism spectrum can lead fulfilling lives, develop their unique strengths, and achieve their full potential. Thank you for joining us today and learning more about autism, its rising prevalence, early signs, and ways parents and caregivers can provide support. If you found this video helpful, please give it a thumbs up and subscribe for more content on health, wellness, and parenting. Remember, understanding and compassion are key when it comes to supporting individuals with autism. Feel free to share your thoughts or questions in the comments below, and don't forget to hit the notification bell so you never miss an update. See you in the next video.